Madam Speaker, members of the board, delegates, colleagues, and guests, it is an honor to speak to you this evening. The day after returning home from the incredible high of my inauguration, I was in the hospital seeing a consult, doing my real job, practicing medicine, when a physician I didn't know came up to me, and since we're at Disney, I'll just call him Dr. Grumpy. He bluntly asked me, "So what are you going to do to fix it?" I was somewhat stunned, and I said, I don't know. I haven't even seen the patient yet. And he said, "I'm not talking about a patient. Aren't you the new president of the AMA? I mean, how are you going to fix health care? It's a mess." Little did I know he was just getting started. He said, "We're getting paid less every year for working harder. They keep piling more administrative stuff on us. The insurance companies and the administrators have all the power. I'm ready to get out as soon as I can." Still somewhat stunned, but shifting back into my AMA mode, I acknowledged his concerns and explained that I, too, experienced all these same concerns. Then, quickly pulling a line from my inaugural address, I proclaimed, "And I'm ready to fight for our profession, fight for our patients." His cool response, "Well, it's about damn time." So, pausing, I asked the obvious question, "Are you an AMA member?" "No," he told me, almost somewhat proud. "I quit years ago. I read something that the AMA did, and it really turned me off." Ignoring all of my media training, I said back to him, "Well, the first step to fix it is for you to join so that we can fix it together." Thankfully, the people in this room know that the work to fix what's broken in healthcare belongs to each of us and to all of us. And I remain optimistic. After all, as you heard, we are in the most magical place on earth. Much of my travels this year have been to rural areas. You see, I've been pitched as the rural physician president, even though my practice is located in a metropolitan area of almost 1 million people. I was told, "You're from Kentucky, you're rural." Accordingly, my travels have taken me to Mississippi, Louisiana, Arizona, Utah, Tennessee, Texas, Iowa, Idaho, Indiana, and South Dakota twice. I've seen Mount Rushmore. I've even seen the world's largest buffalo. And I nearly missed my plane in Sun Valley, Idaho. They all kind of blend together, because the streets were filled with the annual trailing of the sheep. Now, in my travels, I've seen some small planes and some small airports, but never before had I seen a sign on an airport entrance that read, "At lunch, back shortly." So I waited in the small parking lot, and after a bit, another car pulled up, and a man in a suit walked over to the door. Seeing the sign, he returned to his car as well. After a bit, a woman inside flipped the sign and welcomed us in. We followed her over to the rental car counter, and she processed our returns. When we walked over to the ticketing desk, there was the same woman. She checked us in along with a family of 4 and it announced, "It's going to be a full flight." Then she proceeded over to TSA. And she announced, "Security is now open." When she asked the guy in front of me for his ID, he said, "You just checked my ID a minute ago over there." And she responded, "Sir, that was airline check-in. This is TSA." A few minutes later, we were sitting in the gate area. We looked outside and we saw the same lady loading bags onto the plane. The other guy turned to me and he said, "If she's flying the plane, I'm driving." This story is emblematic of healthcare today, as fewer physicians are asked to do more and more. You see, the challenges that healthcare faces are not hypothetical. They are here now and magnified in these rural areas where patients face today a shortage of 20,000 primary care physicians and where 80% of the counties do not have a specialist for care. And 1,100 counties are without a single obstetrician. We have all heard the alarming statistics. 1 in 5 physicians hope to leave practice in the next 2 years. 1 in 3 plan to reduce their hours. And 40% of current medical students are unsure they ever want to enter clinical practice. These are not just statistics. These are our colleagues, our brothers and our sisters in this profession. I want to read to you part of a letter that was shared with me by a friend, an obstetrician gynecologist in a rural area. To my patients, it is with profound sadness and a heart full of memories that I'm writing to inform you that after 27 years of dedicated service, my practice will be closing on October 31st, 2024. This decision marks the end of a chapter that has been filled with joy, challenges, and countless moments of connection with each of you. The world of independent medical practice has become increasingly difficult to navigate, and despite my love for the work and for all of you, the financial pressures have reached a point where I can no longer sustain the practice. I am keenly aware of the challenges you may face in finding new care, especially given the strain on the other practices in the community. I am deeply grateful for the trust you have placed in me, and it has been an absolute privilege to be part of your life. Thank you for allowing me to be your doctor, your confidant, and your advocate. We cannot afford to lose even one more doctor. This letter broke my heart. The financial strains and reality expressed in this letter have unfortunately become all too common. We're all familiar with the 29% reduction in Medicare payment to physicians since 2001, and now it's official. CMS proposes another 2.8% cut for 2025, while at the same time, they estimate that our expenses to provide that care will increase by 3.5%. This is simply unsustainable. It is pushing physicians' practices to the brink of financial ruin. And it's not just Medicare, because in most states, you see, Medicaid rates are linked to Medicare. And private payers who are keenly aware of the 2-decade downward spiral of Medicare payment often tie their physician contracts to the Medicare rate. This puts us in an impossible position. Either turn away the patients, reduce your hours, or close your doors altogether. And in each of these scenarios, it's our patients who suffer, particularly our nation's elderly and disabled persons. This is why Medicare payment reform has been the AMA's top advocacy priority and why it will continue to be our top priority until meaningful reforms are achieved. So how do we fix it? Well, to quote the words of 233 bipartisan representatives in a Dear Colleague letter addressed to the congressional leadership, quote, to prevent the very real scenario of insufficient access to physicians treating Medicare patients, Congress must stop the 2.8% cut from occurring in 2025 and the enactment of targeted reforms to statutory budget neutrality requirements and provide physicians with a payment update reflective of inflationary pressures. And to follow up on the letter, last Friday, the Medicare Patient Access and Practice Sustainability Act of 2024 was formally introduced, a bill that will eliminate the 2.8% cut and provide an update that is based upon the inflationary cost of the practice of medicine. Now, Congress must prioritize this legislation during the upcoming lame duck session. Make no mistake, this is going to be an uphill battle. But I believe that if a unified voice of physicians comes together from across the country, from every state, from every specialty, we can fix it. We can fix Medicare now. As physicians, we're also all too familiar with the needless delays and denials from prior authorization and the harm that it causes to our patients. We all know that prior authorization denials are rarely, if ever, rooted in science or evidence. When I get on the phone to appeal a denial with a so-called peer, it's often that I'm not talking to a physician. It's almost never a fellow otolaryngologist. Heck, a lot of times they can't even pronounce otolaryngology, and yet they're making the decision. After years of sustained pressure, I'm happy to report that with the unified front of a federation and the AMA, we have over 24 prior authorization reform bills that were enacted in 2023. And on a federal level, when we couldn't get the fix in Congress, we went straight to CMS. And our advocacy was instrumental in CMS passing a final rule earlier this year for government-related health plans to reduce the time frames for prior authorization, to improve transparency, and for payers, imagine this, actually have to give up their fax machines. Congress is finally hearing our message as well. Now quoting from a letter to CMS, not from the AMA, but from the chair of the U.S. Senate Committee on Finance and several influential members of the House. Medicare Advantage plan use of prior authorization has skyrocketed, reaching 46 million requests in 2022 alone, burdening healthcare providers and delaying care. 46 million requests for MA plans alone. Let that sink in for a moment, and the waste of the resources in a physician's time. The letter goes on to say, overuse of prior authorization is not only harmful to patients, it hinders healthcare providers' ability to offer best-in-class service. I couldn't have said it better myself. Our AMA, now with the support, has introduced, once again, the Improving Seniors Timely Access to Care Act. And I'm happy to report that last week, the modified version of the bill received a CBO score of $0. And now this bill has 221 House co-sponsors and 54 Senate co-sponsors, which reflects true bipartisan, bicameral support. We urge Congress to pass this bill and to pass it now, because together we can fix it. The final challenge that I want to address this evening is scope of practice expansion. Simply put, patients deserve to be cared for by a physician. And patients agree, with over 95% of patients saying that they want a physician involved in their diagnosis and their treatment. The data now confirms what we as physicians already knew, that non-physician providers use more resources, overprescribe antibiotics and opioids, order unnecessary diagnostic tests and images, and when you put it all together, patients that don't have a physician involved in their care have worse health outcomes and higher overall health care cost. Now, thanks to combined advocacy, again, between the AMA and the Federation, with bipartisan support, this time at the state level, we've secured significant scope victories to protect patients, defeating more than 80 bills this year, including those that would have removed physician supervision from nurse practitioners, allowed optometrists to perform eye surgery, and licensed naturopaths to prescribe medications. Now, let's be clear. Changing your name from physician assistant to physician associate does not mean that you went to medical school. The only way to fight these battles, to fix it, if you will, is with a unified front. And let me be clear, the AMA will not back down. I recognize that we've come to the end of a polarizing election, and that makes it all the more important that we find common ground on those issues that we know are harming our patients, harming our fellow physicians, and harming our practices. Our AMA works with Democrats and Republicans to fix the flaws in the healthcare system and improve public health. And that means advocating for meaningful solutions regardless of who is in power. Be assured that we will always remain true to our mission, that we will always stand for science, for evidence, and be guided by the policies of this House. Shortly ago, I saw Dr. Grumpy again in the hospital. I wasn't really looking for another encounter, but he approached me and he said, "I've been following you in your work at AMA. I've seen some of your quotes in your interviews. You really are fighting for our profession and fighting for our patients." And then he showed me his AMA membership card. You see, this work to advocate for our profession, for our patients, belongs to all of us, to all of you, to all in our profession. At my very first AMA meeting, I saw the power that physicians could have when they come together as a unified body. All these years later, I still believe that the AMA makes a difference for our patients and our profession. I still believe in the power of a unified profession. I still believe because I have seen our advocacy in action and I have seen the results. I truly believe that together we can fix it. Thank you.